Nation plagued by a global pandemic. Many hospitals in a majority of the counties are operating at bare minimum capacity as nurses and clinical officers strike enters day 5 in few hours. The doctors are gearing up for an industrial action should the government fail to honor their grievances. It has been a long-drawn battle between the healthcare workers, doctors, the national and county governments. Soon after the deadly and highly contagious virus arrived in the country, doctors and other healthcare workers started demanding for proper protection and augmented welfare. Well, the promises were made, and if the word of the medics and the healthcare workers is anything to go by, the promises remained just that, promises. The contest has lingered for close to 9 months now, and the chickens have come home to roast. Well, it is the worst experience for people seeking healthcare services in public facilities. Terminally ill patients are getting it rough. Their clinic appointments have been cancelled indefinitely, and their excruciating pain notwithstanding. But the healthcare workers insist their plight must be looked into first. Their predicament is equal to dancing with death. So far, 13 doctors have succumbed to the virus, and tens of others are actively battling the infection. At least 31 nurses and 9 clinical officers have also lost the battle to COVID-19. The fact of the matter is, these professionals are the frontline soldiers in the war with the deadly invisible enemy. And like they have clearly put it on several occasions, theirs is a battle in which the soldiers are fighting without any body armor. Death, for this matter, is not a matter of if, but then. They complain that the generals have the armor but will not release them on time for whatever reason. The government has on several occasions responded to the matter, saying they have done all they can to help the healthcare workers as safe as possible. At one time, ODM leader Raila Odinga even told the doctors to understand that the virus is killing many other Kenyans and that the medics should be realistic. Yes, several politicians have also died and none of their living colleague is complaining. However, even in a battle, soldiers understand that collateral damage is sometimes inevitable. But they will never be sent to the battlefield without the requisite arsenal. That will be suicidal. So why is it different when it comes to healthcare workers? COVID-19 patients go to the hospitals to seek treatment. The hospital is the workstation for doctors, nurses, and clinical officers. It is basic knowledge, right? It is also basic knowledge that the virus is first spread when people hold gatherings without adhering to prevention protocols. The same politicians who cannot decode mere basics are also the ones leading in gathering people for political events at their own expediency. I repeat, gathering people for their own expediency. Simply put, the healthcare workers are on their own. Pardon me, I should say this, that the healthcare workers and their COVID-19 doused workstations are on their own. That is our voice tonight. These are the stories making headlines tonight.